Assalamu alaikum, dear viewers. I am Dr. Nafisa Rashid, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. Today, I am going to present Narcotic Analgesic. What is analgesic? These are the drugs that relieve the pain. There are multiple types of pain. Some are visceral, some are somatic. Somatic like joint pain or headache, or any type of pain in the limbs. In that case, analgesic can be divided into two types according to the relief of pain. They are narcotic analgesic and non-narcotic analgesic. The narcotic analgesics are the drugs that produce narcosis. Then what is narcosis? It is a state of CNS depression characterized by the deep sleep from which an individual cannot be aroused by ordinary stimuli and invariably associated with the tolerance and dependence. There are multiple things to know, that is, the morphine or the narcotic analgesics causes CNS depression and they produce deep sleep. What do you mean by deep sleep? This type of sleep in which an individual cannot be aroused by ordinary stimuli. Stimuli like the fall of the keys or sudden shutdown of the windows, like this type of sound cannot arise the individual. And also it invariably associated with the tolerance and dependence. That means this type of drug has chance of drug abuse, that many people do abuse this drug. Now, what are the difference between narcotic and non-narcotic analgesic? The narcotic analgesics produce analgesia by doing narcosis, and non-narcotic analgesic does not produce any narcosis. They are associated with tolerance and dependence, whereas the non-narcotic analgesic are not associated with the tolerance and dependence. The example of opioid analgesics are morphine, pethidine, and non-narcotic analgesics are mainly NSAID, that is, non-steroidal anti-inflammatory drugs. Chemically, the opioid analgesics are alkaloids, and we know that the alkaloids are finished by the three alphabet like INA, and you can notice that morphine is finished with the INA, these three alphabets. And non-narcotic analgesics are more acidic, like aspirin comes from the acetylsalicylic acid. Opioid analgesics relieves the visceral pain, and this is an important topic, that is, visceral pain can be removed by the analgesic opium because it acts through central nervous system. On the other hand, the analgesics like aspirin or non-narcotic analgesics relieves the somatic pain. They are not used to relieve the visceral pain. This is one of the most important differentiation between opioid analgesic and non-narcotic analgesic. Again, opioid analgesics act by the opioid receptor. Then what are the opioid receptor? These are the mu, kappa, delta. And non-narcotic analgesics acts on the cyclooxygenase enzyme. Here, the cyclooxygenase enzyme acts as receptor. The route of administration of opioid analgesics are parenteral, and whereas the non-narcotic analgesics are oral. You know it as this is why this in the route of an administration of opioid analgesic is parenteral, because if we give this to oral route, there will be fast metabolism and it will be digested by the digestive juice. And opioid analgesics have no anti-inflammatory or antipyretic or antiplatelet effect, whereas non-narcotic analgesics have this effect. Like you know that aspirin has antiplatelet effect, on the other NSAIDs have no antiplatelet effect, but only aspirin has antiplatelet effect. Now I am going to the next slide, that is, what are the characteristics of opioids. The main characteristics of opioids are given below, that is, it comes from the poppy capsule. The poppy capsule, this is an unripened capsule, and there is a longitudinal incision, and there is white exudate is come out through the capsule, and that is dried up and opium is collected. They produce analgesia by acting on central nervous system. That's why they cannot be used as the somatic pain, only in the visceral pain. It undergoes the first pass metabolism, as I have told you that it cannot be given orally. It can cross the placental barrier, so it cannot be used in the delivery pain, because if it is crossed by the placental barrier, the placenta has no enzyme to metabolize the morphine, and as a result morphine can cause cardiorespiratory depression to the fetus. It produces tolerance and dependence. Now I am talking about the classification of opioids. Classification of opioids can be classified according to different topics, like according to efficacy, according to source, according to pharmacological effect, etc. At first, I am classifying it according to efficacy. It can be classified into two types, like low efficacy and high efficacy. The low efficacy is codeine, dihydrocodeine. This codeine is used in the cough syrup. As a result, if we take cough syrup, there is drowsiness due to this codeine or hydrocodeine. And high efficacy opioid are morphine and pethidine. Pethidine is so common, you have known it earlier, but morphine is the main drug of the opioid analgesics. According to source, it can be classified into three types, like natural, semi-synthetic and synthetic. Natural, the examples are morphine and codeine. Synthetics are heroin, oxymorphine and hydromorphine. And synthetics are pethidine, fentanyl and pentazocine. And fentanyl, we will discuss it in our anesthesia chapter. What is fentanyl? Now, according to pharmacological effect, it can be classified into three types, like full agonist, partial agonist and antagonist. You know the definition of full agonist, that is, the drugs will bind with the receptor and produce action. These are called full agonist. And partial agonists are those drugs that bind with the drugs, but in case of strong agonist, it will be act as the antagonist. And antagonists are the drug which binds with the receptor and produce no action. So these three types are full agonist. Examples are morphine, pethidine, codeine. Partial agonist, nalorphine, pentazocine, and antagonist are naloxone, naltrexone. Naloxone is short acting and naltrexone is long acting. These things are very important for your viva examination, because the examiners asks often this type of question. Now, what are the endogenous opioid? Endogenous means that that exists in our body. This type of opioid that relieves our pain by naturally, that is endorphin, dynorphin and enkephalin. Endorphin acts through the mu receptor, and dynorphin acts by kappa receptor, and enkephalin acts through the delta receptor. So if you are asked what are the receptors of morphine, you will answer there are three types of receptor, mu, kappa and delta. Now the prime drug, morphine. Morphine is source is the Morpheus, that is called the goddess of dream. It is a Greek mythology that morphine comes from the Morpheus, and there is a goddess which brings dream to the people. It produces euphoria, that is, patient is very looks like very happy, they have no sorrow, they are no distress. This type of drug is morphine. And the source is Papaver somniferus. This is the scientific name of morphine, and chemically it is alkaloid, as I have told you. Now, what are the pharmacological effect of morphine? I will discuss only the CNS effect today, and in the next class I will discuss the peripheral nervous system effect. Now, CNS effects are two types. One is inhibitory and one is stimulatory. The inhibitory effect, you will utter the inhibitory effect first, because it is the most important effect of morphine. So, you will never tell stimulatory. At first, you have to tell the inhibitory effect, because for this reason we use the inhibitory. And I am uttering only the headlines today, and in next class I will discuss you. The headlines are analgesia, hypnotic effect, respiratory depression, cough suppression, heat regulatory center suppression, vasomotor center depression, and euphoria and dysphoria. And also stimulatory effects are the stimulation of the adenogerosphere nucleus, that is the third nerve nucleus, and causes meiosis to our eye, and stimulation of the chemoreceptor trigger zone that causes vomiting. Also stimulates the vagal center that causes bradycardia, stimulates the spinal cord that causes the truncal rigidity, and also it initiates the supraoptic and paraveter nucleus. As a result, there is increased antidiuretic hormone secretion, and it also causes changes in mood. So this is all today. Next class I will discuss these topics again. Okay, Allah Hafiz.